Well, Ali, thank you for the invitation to present today. The presentation I'm about to go through will be released to the ASX in full, so I'm only going to quickly call out the highlights here, as the presentation will be available for all the extra details. There is a lot to what we do, so I will just touch on those highlights today. We are a 20-year-old company, and we are focused on the commercializations of a very unique technology called 3-base technology and its application to the rapid and accurate detection of infectious diseases. And this is done under the EasyScreen brand. So our results inform doctors to help them to make a diagnosis. So ultimately, our test kits are helping to save lives by recognizing those infections. The kits we make are available in most major markets, and we've been selling versions of these kits for the last 10 years. We just reported our best second quarter on record with revenues of 1.4 million, and first half revenues are also a record with almost 22 million in sales. Our 4-year compound growth rate of 93%, and we have labs around the world using our tests every single day. The sales model is very straightforward. Our customers are mid to high throughput diagnostic testing laboratories. They order kits from us, they pay us on standard terms. So for us, sale to cash is quite a quick time. The testing lab runs those tests, and in turn, they're reimbursed through government subsidies. Genetic Signatures is profitable. We have 37.5 million in cash. We have no debt. In the last 2 quarters, had a positive cash flow. We now have a footprint in our target markets, that's Europe and the US, and we're building off the success we've had from our home base in Australia. Our 3-base technology is now trusted and proven, and it helps us make what are known as syndromic test kits. And you can see here what that means is that we're able to test for a broad number of clinically relevant infections based on patient symptoms. So respiratory is obviously topical, and someone with a sore throat and runny nose could have COVID, but they could have influenza, they could have rhinovirus or other mild respiratory illnesses. And so our tests, the syndromic tests, are able to look for all of these infections in the one patient sample, which is effectively one test. The technology is a molecular technology. It's a PCR test. So we are considered the gold standard diagnostic test. And on the right of this slide here, you can see our Genetic Signatures branded instruments that we supply. And if you like, these are the printers in the printer and cartridge model because they run our tests. Now, 2 important things to note here. First is that we've quadrupled the number of these instruments that we've had in the field during the last 2 years. And these instruments are revenue generating for us. So we now have a much larger installed base, given our recent progress. And the second point to make is that all of our tests work in exactly the same way, regardless of the test being used. So once Genetic Signatures develops and releases new tests, existing customers can very easily integrate these new tests into existing workflows, as well as opening doors to new customers. So I think our increasing revenue reflects the success of this strategy. And you can see here our revenue growth, 9.4 million just in the last quarter and 21.8 million in the first half of this year. So that's more than 4.5 times our entire financial year 19 revenue just in the last 6 months of this first 6 months of this financial year. We're now in expansion phase. We are focused on Europe and the US, and our international sales teams are in place. So they've had good success in signing up customers for our tests, not only for COVID, but for the full respiratory screening kits, as well as our enteric range of kits. And the quadrupling of instruments is a great base from which we can continue to support future growth. And we're in a very strong position to execute on those expansion plans. Positive cash flow for our second quarter of 4.5 million and 7.4 million for the first half. We did recently outline to the market a planned use of funds. It's listed here. It includes the development of a 3-base specific sample to result instrument, which we believe will be a game changer for testing labs, as well as setting funds aside for regulatory trials, submissions, and developing a new amplification technology that we hope will slash the time to result. Genetic Signatures produces many test kits. It's in addition to our COVID test kit. And the next slide here will show you those that we are having production or having development. Our enteric and respiratory detection kits have TGA and CE-IVD accreditation. We're free to market those in those jurisdictions. We are also seeking FDA clearance for our enteric protozoan kit, and we are currently in the trial stage for that. I'll tell you a bit more about that in a moment. But the key here, from a revenue point of view, is that we have 7 additional products that are either have some regulatory registrations or that are coming through the development and commercialization pathways. And we remember that these tests, the new tests, all work in exactly the same way, with many compatible instruments already in the field and in use every day. In terms of COVID, we were able to release a COVID test very early, but we've continued to improve on that test throughout the entire pandemic. Because of our free-base technology, we are a perfect match to 99% of all known variants. That includes Omicron with its mutations, without any change to the sequences that we detect. Again, that's from free-base. We've increased our patient sample compatibility to include the use of saliva. We've developed a kit that can differentiate Omicron from other variants. We've considerably sped up the time to result, reducing time to result by 1.5 to 2 hours. And importantly, we've maintained our sales volumes despite lower testing in the recent past, as labs are no longer able to pull patient samples together given current positivity rates. In terms of investment summary, we currently have a market cap of around 185 million, fairly liquid with 2 million shares turned over on average every month. Asia Union is a majority holder, given that Christopher Abbott from Maple Brown Abbott was a founder of the company and supported us for 15 years prior to listing. Obviously happy to have Perennial and Fidelity on our register also. So looking now briefly beyond COVID, we're already leveraging the gains that we've made in the last 2 years. We've established a direct sales effort in Europe and the US. We're targeting at the moment those newly acquired customers with other approved tests that we had before the pandemic, including those for non-respiratory targets. In terms of product development, we're continuing to progress our regulatory submissions. We're investing in the next generation instrument. Developing new kits will be revenue generating for genetic signatures. And we are now working on newer technologies, and we've recently filed a provisional patent to cover off these inventions. But I'll conclude by summarizing the investment summary. First, it is our revenue growth. We've achieved our maiden full year profit. We're cash flow positive in the first 2 quarters of this financial year. There remain significant market opportunities for us, particularly in Europe and the US, where combined, we're over 70% of the world market. We've invested in product development and expansion, as I outlined. And finally, we have a proven business model. We have increased recognition in the bigger international markets that we're chasing. And we have a unique Australian technology that we are obviously exceptionally proud of. So in the interest of time, I will stop there, but happy to take any questions if time allows.